Good afternoon, everyone, and happy Sunday. Thank you so much for joining us in this webinar. So this is brought to you by the Asian Institute of Culinary Medicine. I am Dr. Michelle Acero Palma, the founder of the Asian Institute of Culinary Medicine. If you're new to this platform, would like to welcome you and thank you for joining us. We're doing webinars 2 to 3 times a month, and we actually handle many different types of topics. So for this afternoon, we'll be talking about salads and dressings. So I'm not going to teach how to prepare this because this is a virtual platform that's challenging unless we're on a workshop. So we also do virtual workshops on food preparation though. But for the sake of webinars, we'll be talking about, is salad really helpful for you? Are there any conditions where salad is indicated? And are there conditions where salad cannot be taken? So because there are terms like neutropenic diet that you hear doctors are saying, do not eat vegetables or fresh vegetables and fruits. So we'll be tackling most of those topics. So again, this is the new face of our website. It's still culinarymd.org. So would like to invite you to visit our website. So it's also there where you can find the link for the weekly or 2 to 3 times a month webinar. So you can save your slot and maybe you can put this in your calendar. So for the month of October, we're gonna be finishing 3 topics. So today will be salads, wraps, and dressings. And then we'll be talking about dietary intervention to reverse fatty liver disease. We'll tackle a bit about cirrhosis of the liver, and that will be October 13. And the focus on October 13 will be mostly on the microbiome and what can we do to reverse fatty liver disease. There are new terms that we needed to understand about fatty liver disease and what do we do in order to prevent progression of this kind of disease to cirrhosis or even hepatocellular carcinoma. And then we'll be talking about diabetes, a disease of fat toxicity. So that will be October 20. So by then we'll be focusing on what can fat do to patients with diabetes, right? So, all right. So this is the second edition of the Culinary Medicine Handbook. So we'll be releasing this in December 2024. This is already out for pre-order. So first edition of Culinary Medicine Handbook is only available in Amazon. You can order the paperback or the hardbound, or it's also available as ebook. We don't have available printed copies in the Philippines anymore as the second edition is already coming out. All right, so that's the QR code if you wanted to have the copy. Of course, in the second edition, we'll be talking about the latest evidence with regards to food-related morbidity and mortality. And then if you got over 100 recipes from the first edition, then here we'll have another set of Filipino and Asian-inspired cuisine. And of course, all of those will be plant-based recipes. All right, so now let's talk about salads and dressings. So we know that why people would usually eat salad because they thought it's actually anti-cancer. So we wanted the antioxidant activities of those common vegetables. We wanted to take advantage of the enzymes, the phytochemicals, the nutrients, the fiber from the salad. And when it comes to cancer prevention, for example, or even patients taking salads because they wanted to help, they wanted it to help, for their recovery after cancer diagnosis or cancer treatment. So what kinds of ingredients do we want to include, in our salad, in the recipe? Now, usually we would want to ask which is healthier. So in a salad, let's say in a salad bar, you will have options, right? So there are different types of lettuce. You have the Boston lettuce, we have the radicchio, we have the romaine lettuce, and then we have the usual curved lettuce, and then we have the spinach. So if I were to ask which of these ingredients, which of these kinds of greens would you want? Which of these kinds of greens would have a better or a higher activity in terms of cancer activity, for cancer cells. So here, as you can see, it's actually spinach, No, it's not the usual lettuce that we thought are very helpful. Of course, all those leaves will have benefit, but here you can see in the graph, the lesser the value here, that means the higher the activity, the higher the anti-cancer activity. That means the lesser the cell proliferation of the tumor cells. Okay, so spinach has a good activity. It has a good inhibition for cell proliferation. And this is true for breast cancer. This is also true for brain cancer. It's also true for kidney tumors. It's also true for lung cancer, and it's also true for pancreatic carcinoma, and even for prostate cancer and for stomach cancer. So of all those veggies, again, when you look at the salad bar, which of those things that you wanted to choose? So if you can find spinach, then that will be helpful. For Filipinos, we have our amaranth. We have our native amaranth here. So if you're so concerned about the oxalates, the presence of the oxalates, you can also blanch the amaranth if that will be helpful for you. So specifically for those who have increased risk of developing kidney stones. Now, how about carrots? So these are the basic ingredients we wanted to add in our salads, right? So how about carrots? It says no. The question is it inhibiting over 50% of the cell proliferation? The answer was no. How about beets? So is it slowing cancer by over 50% in the study? The answer was yes. Yeah, how about cucumber? Is it slowing cancer by about 50%? The answer is actually no. How about tomato? The answer is also no, about 50%. But again, I'm talking about over 50% decrease in cell proliferation, right? But they have their benefit. We're actually looking at the level, their inhibition with regards to the cell proliferation. How about potato? The answer is also no. So all these veggies, so your cucumber, your tomatoes, your carrots, your potatoes, so your lettuces. So usually these are the basic ingredients we put in our salad. They have good activity for cancer, but not actually that much. No, there's not a lot of activity in terms of anti-cancer. So it's beets and spinach that was seen in the study. But then, because they are also rich in other antioxidants and they're also rich in phytonutrients, they have other benefits as well. So here in the study, majority of the vegetable extracts that was tested in this study commonly consumed in the salads because we adopted the Western way of producing salads. In fact, the usual Filipino salad is usually these are indigenous vegetables like sweet potato leaves, those are the things that we use, especially if this is the purple sweet potato leaves that's high in anthocyanin. It has even higher activity with cancer proliferation. So that's what we're seeing with anthocyanin. But we have adopted the Western way of preparing salads, and so with regards to potato, carrots, lettuce, and tomato, they had little effect on the proliferation of tumor cell lines. So how about anti-cancer superstars? We know that the cruciferous vegetables and of course the allium family, they have good activity in terms of anti-tumor proliferations. We have bok choy, we have cabbage, right? So we have our broccoli. We even have the ferns, Brussels sprout if this is available in Singapore and other countries. And of course, when you look at the evidence, what in this vegetables has the high or this ingredients has the highest activity, you can see that it's garlic. So like I said in this table, what you will see here is the lesser the value, the higher the higher the activity in terms of anti-proliferation activity of this ingredient. So garlic has the highest, and this is true for breast cancer. This is also true for brain tumors, for kidney tumors. Same thing with lung tumors, for pancreatic carcinoma, and also for stomach cancer. So there you will see when they are actually compared head to head. So this is green onion, this is garlic onion and leek. So these are the allium family. And then kale, broccoli, cauliflower, cabbage, These are the cruciferous family. You will see that the highest activity are actually those belongs to the allium family. But basically, these two families, the cruciferous and the green onion, they are the superstar ingredients that should be included in the salads, if you wanted to think about anti-tumor activities. So not really on the lettuce, not really on the cucumber. So we know that carrots is a good activity, but it has lesser, relatively lower compared to allium family and then the cruciferous family. So this is the right time for us to add these ingredients in the salads that we're gonna provide. So I'd like to bring this here again. So just for you to see and to summarize. So here you will see the allium family right here, and then the cruciferous family, except that of bok choy. So of all the cruciferous family, it's bok choy who has the least activity in terms of tumor cell proliferation. But the rest, of course, you have their eggplant, carrots, tomato. They have activity as well, but they have lower activity in terms of cell proliferation. So the superstars are this family of vegetables. So again, the allium family and then the cruciferous family. That's true for breast cancer. It's true for brain tumors. It's true for kidney tumor, for lung tumor, even with medulloblastoma among kids, among children, pancreatic carcinoma, prostate cancer, and of course, stomach cancer. So the take-home message here is add allium family and then the cruciferous family on your salads. So again, in conclusion, the cruciferous and allium vegetables in the diet is essential for effective dietary chemopreventive strategies. So why not start adding those ingredients on your salads, right? So here, I'd like to talk about the neutropenic diet because neutropenic diet is really commonly prescribed among patients with cancer. So usually this is what we hear. If you have cancer, if you have a relative with cancer, usually, and if you're a lifestyle medicine physician or trainee, you will encounter this. That patients will be told you're not supposed to eat salad, you're not supposed to eat raw because you're on neutropenic diet. So what about the neutropenic diet? In fact, in this study, it's entitled The Neutropenic Diet Reviewed, Moving Toward a Safe Food Handling Approach. So actually, if you look at the different types of studies, there is a striking lack of evidence to support the view that a neutropenic diet will prevent infection in neutropenic patients. So remember, among cancer patients, they are immunocompromised, right? Especially when they're undergoing chemotherapy. So their goal is to avoid infection. That's why doctors wouldn't like them to eat raw, right? Because they said they may have infection coming from the food. But here in this literature, does the evidence support this intervention? Here you will see that the neutropenic diet is one of the components of the total protective environment that is still practiced today, even with the lack of evidence. Yet it is the intervention with the least amount of evidence to support its use. So that means it's not evidence based, right? So it's a blanket statement that usually what we call this prescribed, to patients with cancer. So their rationale on their basis, on why do they tell patients to go on neutropenic diet? Because number one, they found out that the bacteria in the stool of patients with cancer are also the same bacteria found in salad ingredients. And we know that bacteria causes infection, and neutropenic patients, meaning patients with low white blood cell counts, are at risk of infection. And the risk is too great in these patients to actually study and compare neutropenic patients who consume salads and those who did not. Take note of number 4. They have these 3 reasons, but then they weren't able to make a study to say that neutropenic diet will work because they said it's actually too risky to put patients on a study on a neutropenic diet. So they weren't able to establish if this is really true for patients who consume salad and who did not. So in addition to the lack of clinical evidence for this diet, there may be some drawbacks to it. So the restriction of fruits and vegetables, this may disrupt the delicate balance in the gut, right? Specifically, there is a risk of bacterial overgrowth and translocation. So that means with regards to food choices, this may compromise the nutritional status of the patient. Just imagine if you don't allow them to take veggies and fruits, but then amazingly, they're allowed to take McDonald's, they're allowed to take Jollibee, they're allowed to take anything that they wanted to eat, anything in moderation, right? So in this randomized comparison of cooked and non-cooked diets in patients undergoing remission induction therapy for AML, so you will see here that the major infection and death and the two major endpoints were similar regardless, no, whether you allow the patient to take salads or not. So that means it's not the raw foods, that's increasing the rate, of infection among these patients. So therefore, this practice was changed. And now everyone was allowed to take a regular diet after this randomized controlled trial was published. Unfortunately, if you are to review, there are still up to now doctors saying, please don't eat the salads. But what's the evidence saying? The FDA and the CDC do not support the neutropenic diet because of the lack of evidence. So I'm sure we're pretty much clear here. So in fact, even the American Cancer Society is saying wash fruits and vegetables very well under running water. They're not even saying wash it with baking soda. They're not even saying wash it with a vegetable wash. There are a lot of commercial vegetable wash available, right? So here, this is the poster I grabbed from the cancer experts in the Philippines. So this is the Society of Oncologists in the country. They said iwasan kumain, meaning get rid of eating raw foods when you're under chemotherapy. So for our Filipino attendees here, I'm speaking in English because we have Malaysian, we have Indonesian, and we also have Indian participants here because AICM is serving all over Asia. So these are the examples. So you have the sushi, the oyster, Caesar salad dressing. Why Caesar salad dressing? Because it has anchovies, the runny eggs, uncooked smoked fish, homemade unpasteurized mayonnaise, and look, unwashed fresh fruits and vegetables. So going back to the recommendation, the American Cancer Society said you have to wash fruits and vegetables well with running water. So in the Philippines, they also said, do not eat unwashed fresh fruits and vegetables. Did they say do not eat fresh vegetables? No, they did not. Right? So it's pretty clear right now. So I hope when you actually encounter patients who will tell you this way, you have something to share to them. What we're showing you now are the evidences, right? So really food becomes a real danger to immunocompromised individuals when it is actually made as vehicle for pathogenic bacteria. And most of these pathogenic bacteria are actually found in undercooked eggs, uncooked meats, unpasteurized dairy, and unpasteurized juices. And of course, you still have to be careful with raw sprouts. And that's why you have to wash them with running water thoroughly. All right. So again, there shouldn't be a debate, about the use of neutropenic diet for cancer patients. Its usefulness has never been scientifically proven. However, unfortunately, neutropenic diet remains in place in many different hospitals and in many different oncologic clinics as of today. So what we wanted to do here is to actually inform and educate our fellows, our colleagues, that somehow, what's in the recommendation is evidence-based and the neutropenic diet really lack evidence. So why many doctors are still reluctant, in doing away from neutropenic diet? The reason for this is because they don't really have time, to read on evidences. So it's like when they're used to saying the blanket statement, then that's being passed from one generation of the doctors to the next. So they just feel comfortable and safe despite the lack of evidence. So this could actually contribute to decrease resistance to colonization by virulent microorganisms because we're not introducing good bacteria, to the patient's gut. So again, is it a good practice or a myth? So not only was neutropenic diet is not beneficial in the analysis, there was also a suggestion that it could potentially be harmful because, patients are not allowed to eat veggies and vegetables already. So anyway, this is not the first time that intervention strategy was made good theoretically in a sense, but eventually it was ineffective when it is tested, when we put them, to the test. But here, how about carotenoids? So we're done with the neutropenic diet. Let's talk about the carotenoids. The carotenoids are actually one of the most commonly used anti-cancer constituents, food constituents. So you always hear carrot blends, carrot juices, given to patients. So you throw carrots and then apples, in a juicer, and then you let the patients with cancer drink them. So you get all those benefits. We know that carotenoids can really have a good activity with tumor cells, but earlier I showed you, yes, it has a good activity, but then not as much as other vegetable family like that of cruciferous and allium family, right? So here, with regards to the carotenoids, the lycopene that you can find specifically in tomatoes, yes, it can help patients with prostate cancer. So specifically, there are many types of tomatoes, by the way. So what was studied was tangerine tomato. So I don't know if you're familiar about the tangerine tomato in the Philippines, but it looks like that compared to the red tomato. So that means the tangerine tomato has 8.5 times more, it is more bioavailable. The lycopene is more bioavailable than the red tomato. So even with tomatoes, it's not equal. And then there's another thing that the evidence is actually saying. Now, when you wanted to take advantage of the carotenoids, when you want this to become bioavailable for the patients to get the benefit, then we have to serve it with fat, right? Because this is a fat soluble constituent, then it has to be served with fat. So that means you have to look for something that you can add in your salad. It could be in your dressing or it could be an added ingredient in the salad so that you take advantage of the carotenoid bioavailability. You may want to add fats from the nuts, or you wanted to add avocado, for example, or you wanted to add a fat in the dressing. Okay, so for you to take advantage of the carotenoid, if you wanted to increase the bioavailability of carotenoid. In fact, if you look at this graph in here, you will see that the absorption of carotenoid has increased whenever you add something with fat. In this case, they added avocado, no? Here, they added avocado so that they increase the absorption of the carotene and then the lycopene from the veggies. So okay, so when you look at your salads this time, you wanted to see the profile of the nutrients that's in there. It's not usually the lettuce that will help you if you're thinking about cancer, but of course, lettuces have a lot of fibers. It can help your microbiome as well. But this is the right time. You add the red beets, you add the onions, you add some garlic in the dressing, and then you add the cruciferous vegetables. This is where you can add your red cabbage, for example, and this is where you add other cruciferous vegetables. So like I've mentioned earlier, the least of the activities, anti-tumor activities, is that of the bok choy, but again, it still can help. And lastly, I wanted to talk about what the dressing can do in terms of adding them to your salad. So usually we wanted people to eat salad first because we want to use it for negative calorie preloading. So what do we mean by that? So remember, your stomach can accommodate about 4 cups of food in each meal. So if you eat your salad first and that is less than 100 calorie per serving, then that means after you eat your salad and then you eat your main course, somehow you will be eating lesser calorie. Look at this study. So in this study, patients were given salad. So participants were given salad first, and the other participants were given just the pasta. So those who ate the salad first, the total calorie they took was less than 900 calories. It's just about 700 calories compared to those who ate the pasta, who took about almost 900 calories. So that means because your salad is fibrous, it increases satiety, and so it reduces the chances for you to consume a lot of pasta. But then here, take note, when you add something fatty in your dressing, if this is too much dairy that you added there, like you added a lot of mayonnaise, and then you added cheese, for example, and then things that you add, in your salad, then it increases the calorie. So not all salads are equal. So I hope that's clear. You thought you're eating salad, you're eating less calorie, but again, you may be eating too much calorie as well for the things that you add on top of your salad bowl. So look at this study. So here they have high calorie density salad because there's chicken in there, there's mayonnaise in there, there's cheese in there, compared to those who just ate the basic salad, and compared with those who just ate the pasta, who had and who took the largest portion of the calorie, those who had the high calorie density salads. All right. So again, when you talk about the negative calorie preloading, it only applies for fresh fruits and most of the veggies. So those are the components of the salads. It doesn't work with bread. So if you add your garlic bread, to your salad, and if it's drizzled with oil, even if it has your garlic, of course, it increases the calorie right there up to 300 to 600 calories per cup. So we wanted the negative calorie preloading to be less than 100 calories per cup, so that the first 2 cups that you eat before your main course is high in nutrients, high in fiber, but this is not energy dense. So that means the calorie is low. So this is applied for patients with diabetes and patients who wanted to reduce some weight. All right, so in summary, we discussed that cruciferous vegetables and allium family has the highest impact on cancer, that means in tumor proliferation, and that neutropenic diet is not supported by evidence, and unwashed raw fruits and vegetables are the ones not recommended. I hope that's clear. And fat-soluble substances such as lycopene and beta-carotene increases its bioavailability when ingested with fat. So there you can add your avocado, you can add your nuts, in your salad, so that your lycopene and beta-carotene from your carrots and then from your tomatoes will be bioavailable. And then salads can be used for negative calorie preloading. And lastly, the salad dressings can easily increase the calorie profile of the food you are eating. So we will be posting a lot of recipes in the second edition. So we're focusing more on the raw food preparation in here. Of course, it's still disease-based. Again, this will be published in December 2024. So again, go visit our website and check out the next schedule. And I hope to see you again in the next webinar. It's a 30 to 40 minutes webinar that we do 2 to 3 Sundays each month. So I hope you'll share this to your loved ones. And this is open to anyone who wanted to learn healthy cooking and who wanted to improve somehow their health outcomes through healthy food preparation. So again, thank you so much for joining me, and I hope you learned something from the webinar this afternoon.